1 in 10 women will experience postpartum depression after giving birth, with some studies reporting 1 in 7 women, yet there is still a little awareness. Dr. Salim Sarani joins us live to discuss. Dr. Sarani, thank you so much for being with us this morning. We appreciate you as always. What exactly is postpartum, and how do you know the difference between postpartum and baby blues?
Good morning, Barbie. Glad to be here. And I'm glad this topic. This is, as you mentioned, it's very common. It affects 10 to 15% of the women. That's a big number. And a lot of the time, we don't even realize what the difference between baby blue and the depression is. Baby blue is very common. It usually starts on third day and it lasts for 2 weeks. And most of the time, it resolves on its own within 2 weeks. So you can see the mom having some difficulty in sleep. Baby is crying, they wake up, their sleep cycle is altered. So they can have some mood swings, they sometimes have a little crying spells or some anxiety. But that is not bad because it just disappeared. But on the other hand, the depression usually, if it lasts more than 2 weeks, but most of the time it usually starts around 6 weeks. And besides some of those symptoms, they become very sad, they have a reduced concentration, they have a trouble sleeping, they start getting withdrawn from the family, they have a very difficult time in bonding with the baby, and they feel hopeless. And that's a very, very major concern as a mother because, at the same time, I think you feel that your support system you need there may not be there. There are a certain group of people we need to keep in mind who are at a high risk of developing. Somebody who has a depression or a family history of depression or mental health, someone who has a very traumatic event in the life during pregnancy, someone who has a mixed feeling about the pregnancy, or some patients, who do not have the good support system. And I think that is a very important thing. And a lot of the time, people don't recognize it. They don't seek the medical help. So I think that the segments usually tries to bring the awareness that it is very, very common, and we need to look out for that and make sure that a new mom doesn't, are not left alone, and there is a good support system around her.
That's very important, a good support system always. Thank you so much, Dr. Sarani. You are a huge support system to us. We appreciate you being with us. If you have a question for Dr. Sarani, please text the number on your screen at 361-855-6397.
And it was great seeing him honored by the Westside Business Association earlier this week.
We're so proud of
Congrats to you, sir.
him.
Yes,
We're so
absolutely,
proud
for all
of
of his hard work, especially featured here on First Edition.
That's right.